So let's talk about SMC by the actual dollar amount. The important thing about special monthly compensation is that it has the possibility to increase your monthly benefit payments. And again, because we're looking at special situations that are above and beyond just the regular disability scale going up to 100%, these additional monthly payments can be significant. This is taking into account disabilities that are above and beyond just the typical disability rating scale. So the lowest level of SMC is SMC-K. This is probably the most common condition that the most number of veterans are entitled to. Currently, as of 2026, the dollar amount of it is $139.87 per month. The SMC levels, just like the VA disability levels, the pay changes every year. Congress adjusts it according to cost of living. So it's always a little different each year. Right now, it's almost $140 a month. SMC-K is given, again, for loss of use, which is exactly what it sounds like. Say I don't have the use of my left hand anymore. I can still use my right hand. VA would pay SMC-K for that, extra $140 a month. That doesn't seem like a lot, especially for loss of use of a whole hand, but we'll get into how VA actually looks at these as we go. The much more common situation I see SMC-K come into play is loss of use of a creative organ, things like erectile dysfunction or female sexual arousal disorder, the female equivalent. If you no longer have that sexual functioning, loss of use. There is also a female equivalent, female sexual arousal disorder called FSAD. A lot of female veterans aren't informed about that, so I want to make sure that you ladies know as well. SMC-K is something that you can be entitled to if your service-connected disabilities, and it can be through medication, it can be through actual injury. Same thing, of course, for loss of use of a hand or a foot. Also, loss of voice. I have had some veterans who are service connected for stroke or other things, and they're no longer able to speak. That's loss of use. So one thing that's really important to consider when we talk about loss of use is it's not actually loss. So in other words, you can have loss of use of a hand without having that hand actually amputated. Then if you were to have the hand amputated, it would just simply be loss of the hand, which you would still get SMC for. Say you have very severe arthritis or another condition that causes your hand to cramp up. You're not able to use it to grip objects. You can't use your hand to write. You can't use it as it was intended. So when we talk about loss of use of a hand or a foot, it does not have to be actual loss. You can still have your hand. It doesn't need to be amputated in order to have a finding of loss of use. The way the specific wording that the VA laws around loss of use of a hand or a foot are worded is loss of use will be held to exist when no effective function remains other than that which would be equally well served by an amputation with a suitable prosthetic appliance. This is not saying you'd be better off with an amputation. That's something even I think the VA and C&P examiners run into. When they're looking at loss of use, they're saying, well, no, he shouldn't have an amputation. And almost no time where we're looking at loss of use is that ever something that we're actually suggesting. It's not saying should the veteran have an amputation. It's saying if the veteran were to have an amputation with a suitable prosthetic, would that give them the same amount of function as they have currently, or even better than they currently have with the current function of their hand, which maybe can't grasp, can't manipulate objects, you are not able to grip things, you just don't have function. You can't write, maybe you can't feed yourself. You just do not have the remaining function that a suitable prosthetic would at least give you, say, the ability to grip. Same thing for a foot. The exact same criteria applies. It's the remaining function of your foot equal to the same amount of function you'd get if you were to have a suitable prosthetic. And the answer a lot of times, unfortunately, in the cases that I'm looking at is sometimes the veteran in this scenario where we can just imagine if we could give you a suitable prosthetic, how would you function? A lot of times they would function better because the feet as they are now, aren't able to balance. They're not able to help the veteran push off the ground. In those cases, a suitable prosthetic foot would absolutely serve those purposes. Where you're looking at is the function, the remaining function. Would it be equally served by a prosthetic? If yes, or the prosthetic would be better, then loss of use is established for that hand or that foot. So one thing also to keep in mind for SMC-K specifically, again, loss of use, this is the about $140 extra payment per month. This goes on top of your disability payment. So say you're getting $3,000 a month as part of your regular payment, this $140 is going to go on top of it.
Hey, Nate here, Hill and Ponton's video guy. The video you just watched is expanded on further in this one right here. Learn something more, increase your rating. As Matt always says, knowledge is power. So go ahead,